Dear friends and colleagues, thank you so much for the opportunity to speak to you on the occasion of World Antibiotic Awareness Week. My name is Pat Turner, and I'm president of the World Veterinary Association. And I want to say a few words about global veterinary leadership to address antimicrobial resistance. Historically, the widespread use of antimicrobials in feed as feed additives for farm animals developed in nations such as the United States, in which there was an effort to improve food production efficiency, and new systems were developed that brought animals together in intensive settings to try to meet the demands of growing cities. Food shortages that had occurred at the beginning of the last century and throughout World War I, the Depression, and World War II created a sense of urgency for politicians, economists, and agricultural researchers. And there was a need to find inexpensive protein sources for these rising populations in cities. These confined animal populations were exposed to the wastes of other animals, and this created new infection risks that really were a major cause of death until the discovery of antimicrobials in around the late 1940s or so. Antimicrobials for veterinary medical use came on the market around the same time, and they facilitated revolutionary improvements in patient care, just as they did in human medicine. This early massive use of antimicrobials in food animals wasn't linked to veterinary usage. It really was for growth promotion and to reduce infections in animals that were held so closely together. The use of antimicrobials also extended to crop and fruits and other practices such as preserving fish and whale blubber. There were early warning signs that antimicrobial resistance was developing in these animals at the time, but because of an incomplete understanding of the mechanism of transfer of resistance between bacteria, this information was widely ignored. And the use of antimicrobials as feed additives increased relatively unrestricted until the mid to late 1980s. We have seen in some countries around the world, so while we have seen massive increases in antimicrobial use, we have been able to see some reductions. And in a recent report that was published by the European Medicines Agency, they've indicated that they've seen a 35% decrease in overall sales of antimicrobials as feed additives in European countries between 2011 and 2018, and specifically almost a 70% decrease in sales of polymyxins for the same use. And what this means is that when there can be intense and coordinated surveillance and follow-up of antimicrobial usage in food animals, we can see actual changes in the pattern of the development of resistance happening in animal and human populations. Another area that we sometimes forget about is the use of antimicrobials in aquaculture. And aquaculture is the fastest growing global food industry with almost a 20-fold increase between 1970 and 2010. This high productivity of shellfish and finfish is achieved by intensive farming practices, and there's a heavy requirement for antimicrobial usage in some countries, such as some in Latin America. And it doesn't matter whether these fish tanks are on land or whether it's in an ocean environment. It can lead to contamination of wastewater and of sediment in ocean floors. Antimicrobial usage in companion animals has not been studied as extensively, and there are very few published papers on this particular issue. The information I have on here is from a recent paper that was looking at antimicrobial usage in companion animal practice in 3 countries in the European Union. On the left-hand side of the graph, you can see different antimicrobial agents, and these are color-coded to match the WHO color classification. So green is an important antimicrobial, yellow is highly important, orange is critically important, and red is critically important of the highest priority. And what I can hope you can see just from looking at the different color patterns is that most of the antimicrobials that are used in companion animal practice are the same ones that are critically important for human medicine. So although the levels of antimicrobial use in companion animals is much lower compared to food animals, the very close association between companion animals to humans results in a significantly greater risk of sharing antimicrobial resistance between species. Traditionally, companion animal veterinarians haven't worried too much about prescribing practices, but all of us need to be have increased awareness on this particular issue. And in one recent paper that was published on antimicrobial resistance in companion animal practice, the veterinarians that were surveyed indicated that the top 5 areas for misuse of antimicrobials were cautionary prescribing, so giving antimicrobials to a client just in case, responding to perceived client pressure, prescribing without a confirmed diagnosis, inaccurate prescribing, and prescribing as a preventative measure following surgery. So these are important things. It really doesn't matter as a veterinarian what area you practice in. We have to be aware of these things. Importantly, in 2020, we have come to recognize antimicrobial resistance as a significant One Health problem. There's significant discussion and sometimes figure pointing regarding how much antimicrobial use occurs in food animals and other species and how it's contributed to global antimicrobial resistance in humans. The exact percentage of this doesn't matter. We've seen clear epidemiologic evidence of transfer of resistance from animals to people working with those animals in farm settings. And I've just provided a classic example of transfer of resistance to ceftiofur to E. coli and Salmonella cerevars in chickens and humans following the use in hatcheries in Canada. Transmission of resistant bacteria from livestock to humans can occur through consumption of meat, direct contact with colonized animals, or spread of the manure in the environment. And there's clear evidence of the spread of antimicrobial resistance from food animals to wild birds and other wildlife living near farms where animals are raised intensively, in soil samples around poultry farms, in pristine environments in polar regions, in animal agricultural waste effluent, and even in the water that we drink every day. So this is a significant problem for us all in 2020. The World Health Organization recognizes the role of antimicrobial use in food animals and how it contributes to antimicrobial resistance in humans. And recently, the tripartite leadership of the FAO, the OIE, and the WHO have established a One Health Global Leaders Group on antimicrobial resistance. And the World Veterinary Association has representation on this working group. Antimicrobial stewardship is the way forward for us to effectively manage antimicrobials so that they will be available to use for generations to come. It's a very challenging problem, and it requires many different steps and integrations, and I've listed a few of these here. This requires integrated surveillance for AMR in people, animals, and the environment, which means we need improved diagnostic lab capacity. Means development of policy and guidance with follow-up and engagement of different groups, including veterinarians. We need regulation and reporting of antimicrobial use and resistance patterns. Particularly in veterinary medicine, we need optimization of dosing and improved understanding of pharmacokinetics and pharmacodynamics of these drugs. We need coordinated messaging, including to the public and to farmers and others. And then investment in sustainable alternatives to antimicrobials to ensure equitable sources of food for people in all countries and regions around the world. An important piece of antimicrobial stewardship is focusing on education and training of veterinary professionals. And I've put a few ideas on here, but for veterinary professionals, they need to be able to have more effective conversations with their clients around antimicrobial use. They need to better document their use of antimicrobials. They might want to work with local diagnostic labs to develop antibiograms, such as that that's shown on the right, to better inform their practice. They need to also maintain their knowledge and awareness of professional principles and regulatory requirements as they surround antimicrobial use. Similarly, we need to make sure that veterinary students have incorporation of information about antimicrobial resistance and biosecurity in their curriculum. Several recent studies, of which I've listed here in this slide, suggest that there are gaps in training programs of veterinary students all around the world. So this is something that needs attention and consistency. One very good free online program that's available in English is this antimicrobial resistance learning site from the University of Minnesota. And there's lots of good information there for all species that's available free for use. The World Veterinary Association, which represents the global veterinary profession since 1863, represents over 500,000 vets in 95 member associations, including the Peruvian Association. The mission of the WVA is to provide global leadership for the veterinary profession and promote animal health and welfare and public health through advocacy, education, and partnership. The WVA is also very concerned about antimicrobial use and resistance, and they have a strong desire to manage this through responsible stewardship. The WVA has initiatives of impacting antimicrobial resistance through our cooperative agreements with global stakeholders and partners such as the WHO, the OIE, the FAO, and the World Medical Association. These issues are handled internally at the WVA by the One Health and the Pharmaceutical Stewardship Strategic Focus Groups. We have publications of position statements, various articles, and press releases on this topic, and we try to facilitate global survey dissemination and data collection as well. The WVA hosts various One Health events and congresses every year, and we also support a One Health focused World Veterinary Day Award. In 2019, the World Veterinary Association and the OIE together had a joint project on antimicrobial oversight. The WVA surveyed members on national and regional actions that they had taken related to antimicrobial oversight and use in animals. And a global repository of guidelines was created, and these are available in multiple languages, including Spanish. And on the right-hand side, it just shows sort of the front page of this particular document and the URL at which you can find the information. This is useful for guiding veterinary professions about general knowledge and understanding about these issues. But another recommendation that came out of this project is one to develop specific clinical guidance for specific species, infectious diseases, and recommended therapeutics. Again, to create some more consistency in the practice of veterinary medicine and to minimize antimicrobial resistance. So just wrapping up, thinking about the way forward as we deal with this very significant issue of antimicrobial resistance, we need prioritized approaches that will be global in scope, but that are sensitive to regional economic and cultural preferences, differences, and requirements. We require an approach that recognizes the need for ongoing prudent and therapeutic use of antimicrobials in human and veterinary medicine. We really need to look at the root causes of diseases and conditions that lead to widespread antimicrobial use so that we can try to develop action plans to prevent them. And we certainly need more data to be collected across all animal sectors in all regions of the world, especially in Latin America. Finally, more research is needed on alternatives to antimicrobials so that we can reduce our dependence on them for growth promotion and improving health when animals are held in large numbers. Thank you so much for your attention. I wish you all well during this week of World Antibiotic Awareness. And I'm happy through the Peruvian delegate to the World Veterinary Association, Dr. Janet Velez, a council member and colleague, to answer any questions you may have about this in the future. Thank you.